welcome to the first episode of the One Small Step podcast. While we're highlighting charities in our community and showcasing what they do and the impact they have. I'd like to introduce Toby Esterby from the Westside Clinic. Thank you for joining us today.
Hey,
Yes.
My pleasure. Thanks for having me today. I'm super excited to help you guys launch this and looking forward to it.
Awesome. Can you give me a little bit of a background on yourself and then also your organization?
Yeah, you bet. So Westside Clinic is part of Saskatoon Community Clinic. We have 3 different buildings in the city, but essentially we're a primary healthcare provider. Saskatoon Community Clinic's been around for years. So
Okay.
we were there when Medicare was born in the 60s.
Really?
That's where we started.
Wow.
We were
Same
at
building?
We
Like,
were
is
at,
that the same building?
we,
or that...
somewhat to our disadvantage, yes, we're in the same building
Right,
as
right.
we were in 1962, but we were there at the beginning of Medicare.
Right.
In
Crazy.
1975, the folks at that point said, you know what, there's a gap here. There's a need for this kind of healthcare in the core neighborhoods of Saskatoon, and that's when Westside Clinic came into existence, 1975. And we're still doing that work today, right from the corner of Avenue P and
Right.
20th Street.
It's a pretty impressive place. I mean, we met, I think it was November, I think it was like the 4th or something,
Yeah.
2022.
Yep.
I'd lined up participating in the homeless challenge, and I met you, I think, standing outside,
Yep,
right?
standing outside.
Standing outside, and we had a good chat there,
Yep.
and we were just highlighting the amazing organizations that we have in our charity, in our city, and what they do, right? And it was, man, have I learned a lot.
Yeah.
Like I've learned so much over, like, since I originally did in 2018 all the way through, like, a lot of cool people doing what they do in our community.
Yeah, you bet. And that's what we're trying to do, that work in community at Westside Clinic, but we're also trying to make sure that there's voices talking about what that work is and how cool it is, and
Right.
that work that's ongoing, and the small army that's in Saskatoon doing that work day in, day out.
And how much you care. I mean, the thing is, like, every single person that participated in that Sanctum homeless challenge has always said, like, I can't believe how many people care about, like, our community and the people, and it's just like the highest praise.
Yeah.
Which is, like, I think that you're probably you probably work harder than any other sector within the city, and also the most underpaid for what you guys do and the hours that you put in.
Ever so slightly, yes.
Yeah, for sure. It's kind of crazy. That's the way that our society works, but
And that's the reality of it, but we're choosing, like, the folks that work in that sector, in the nonprofit sector and health sector, whatever it might be, they're choosing that work every day because they know they can make a difference from that work, which is what you guys are trying to do with this podcast, right? What can we do, that little thing, to make a difference? That's why we go to work every day.
right.
It makes my heart so full, you know, like, because as a guy who barely ever leaves the house, there's so many things you want to help out with, and there's so many people you want to join in their cause. And for a lot of people, it's hard just to get yourself out of the house, let alone finding a place to go and do good things. And it's so exciting for me with this to learn as we go too about all of the stuff that's going on and how we can help make a difference. Kind of like these shirts.
Yep.
You see these bad boys? Tell us about the shirts here, Toby.
So 1,500 block shirts. These are honestly, these are the brainchild of a meeting where we were talking on the side of the meeting about how frustrated we were about the message that was out in mainstream media about where we worked.
Yes.
So you'll recall, last summer, lots of media attention to concerns about crime, concerns about community safety, and all of the conversation, everything that was said was about the 1,500 block of 20th Street West, the 1,500 block, the 1,500 block, all of this stuff going on in the 1,500 block. And the statistics around crime and the statistics around some of the work being done was so very different than just the 1,500 block. So we were upset about that. We wanted to change the messaging. So it started as a joke, to be really honest. It started as
Isn't
a
this
joke.
kind of a little bit of straight, like, not
Straight
like
outta Compton,
straight
right?
outta Compton.
Yeah.
Well, that's totally what it was. We were trying. I cracked a joke that I was going to make a T-shirt and we were going to put silly things on it, and somebody in the room said, like, straight out of 1,500. I was like,
Wait a minute.
They're a nice
That's
t-shirt.
good.
This is a
Light
nice
bulb.
Yeah.
t-shirt.
Yeah, that's
So
awesome.
like you'll notice that they're free of logo. They're free of all they say is straight out of 1500 block. What we're trying to do is change the conversation. Like straight out of 1500 block comes some of the best work that's being done in this community around homelessness, around healthcare, around substance use disorder, around vulnerable populations, around poverty. Some of the best work in the city comes out of the 1500 block. So we wear them with pride.
Right.
This is about what comes straight out of 1500 block. The other thing too is that we made a bunch of them. We're running out now, but we made a bunch of them. And we let people know, like when you wear them in public, everybody's like, what's that?
Yeah.
And they
badge
want to
of
know
honor.
more. And they want to get involved.
Yeah.
And how can I get one? I want to buy one. It's like, well, no, you don't have to buy one. All you have to do is come by Westside and drop off something for, you know, what it might be if it's the clothing that we're giving away at the door for warm weather or for cold weather, or if it's snacks that we can hand out at the door for folks that are hungry, whatever it might be, and people dropping that off. And we've been giving them T-shirts in exchange for that.
Oh, that's awesome.
Yeah,
That's
so
amazing.
like we're just about out of them now, so it's kind of run its course. We'll probably do some more next year, but it's really getting that message out, and it's a ton of fun.
Like you said, it's no logo, but it's a cause.
Yeah.
Right?
Yeah.
Like it's so much more than a
It's
logo.
about the work, right? It's
Rally
not about the
call.
organizations, it's not about the people, it's about the work.
Yeah.
So,
Yes.
and then that gets back to, I think I cut you off before, so I apologize. But what work do you do? What programs do you have at the Westside Clinic, and like what do you do there?
Yeah, so my role is Chief Operations Officer, so that's just a fancy way to say that I'm try to be in charge of everything. Fail miserably, but I try to be in charge of everything. At Westside Clinic, what we are is a primary healthcare center. So we are what most of us recognize as a doctor's clinic,
Okay.
but we're so much more. So you walk into Westside, and as far as that goes, you walk into either of our clinics, you're accessing your doctor, nurse practitioner, nurse, your clinical rooms, just like you would see in a normal clinic. But our folks can also see a physiotherapist, they can see an occupational therapist, they can engage with my outreach team, they can engage with our counseling services, they can see an addictions counselor, they can see a nutritionist, they can see a dietitian, they can do chronic disease management around diabetes or HIV, or many other things. They can engage with any number of service providers, and we wrap holistic care around our patients. So at Westside Clinic, when we are serving a community that often faces significant barriers to accessing care, we are that welcoming place where people know that it's safe to go to get their healthcare needs addressed in that day.
The one thing that I've noticed when I've driven by and is that there's always a lineup, and it's like how many people, like how many clients do you have?
It's so busy, and it just keeps, like, those lineups keep getting longer and longer and longer. About 5-6 years ago, we had about 2,500 patients. We're approaching 7,000.
How do you like?
It's
That's so many.
it's so many, right? And we're open 9:30 to 9 on weekdays. We're open Saturdays, and we do walk-ins twice a day for our folks, right? Like it's for folks in the neighborhood, and both of those walk-in spots. Today's a great example. So Tuesday, I had a full docket of nurse practitioners, doctors. We had all of our services running, everything like that. We had walk-in spots every day. We hold in each of our providers. We hold spots for walk-ins,
Right.
so folks can get urgent care.
Yeah.
And every day when the door opens at 9:30, we fill them up. By 9:40, they're filled. And then we're gonna open them up again at 5 o'clock tonight, and by 5:10, they'll be full. So the demand is ever constant and ever growing.
How many people would you, or how many clients do you have that are homeless? Like, do you work with a lot of the homeless population?
Yeah,
or-
we do a significant amount of work with folks that are experiencing homelessness. That's a factor of a couple things. Number one, back to creating a welcoming environment,
Right.
right? The folks that are experiencing hardship and homelessness and poverty need to have a place to access care that feels welcoming, and we create a culturally safe,
Not judged.
not judged. Yeah, exactly. Like you would have experienced some of it when you were doing the survivor challenges. Like you need to feel safe. You need to feel like people want you there in the room. So folks are used to being able to feel that at Westside, so they come back.
Right.
And they tell the folks that they're in community with. The other thing that creates that is the reason why Westside is where Westside is. You know, core communities in any urban population are traditionally where some of the less affluent families create neighborhoods, create homes, create community.
Right.
So those folks experiencing less affluence in their life, they have every right to access care, barrier-free care. So that's where we end up doing a lot of work with homelessness. I would say I don't want to take a guess at a percentage. It's way too high, the number of our patients that are homeless, way too high, and it just continues to grow. There was a weekend, 2 weekends ago when it was super cold. We actually had that was the first weekend that the city had both of the warm-up spots open, overnight warm-up spots. So there was overnight warm-up spots, there was the shelters running, the wellness center, and then there was the folks that the ministry had put in hotel rooms to stay warm for that night.
Right.
Our rough math on knowing where that is, a couple weekends ago, to stay out of the cold, there was over 900 people.
Oh.
So there's and most of those folks during the day when they need to access medical attention, they're trying to get to Westside.
And at least from my understanding, and correct me if I'm wrong on this, is that you had the number 900, but at the same time, there's a lot of other people that were still on the streets and couldn't get into shelters and couldn't do things, right? Like,
Yeah,
isn't that the factor here? Like,
Well, and yeah, like that real number of homelessness in Saskatoon is such a hard number to accurately get. I've been working in this sector for years now. I can tell you that number is extraordinary. You think of, like, now that we're in winter, there's folks that are couch surfing. There's folks that have moved back into unsafe places to
Just
call
to stay
home,
warm.
just to stay
Yeah.
warm. You know, things like that. That's what's happening in our community. So we really need to do that work to get that recognition out. When I tour somebody around Westside, and I've long since been putting that out around everywhere I can. Come see me for a coffee. Let me give you a tour of what
right.
we do here.
Yeah.
When I tour people around Westside, they're always just flabbergasted by the level of challenges that people are facing. It's shocking.
Yeah, until you actually, it's interesting. Like, until you walk a mile in someone's shoes, you have no idea. Like, what are some of the things that most people, or misunderstandings of homeless people, right? Like, I always hear, like, it's addicts and it's drunks and it's so forth. But
Yeah.
I mean, a lot of times that's not where they're at. Like, when we did the homeless challenge, the first night that we were there, it was raining, and we were with 3 executives that you would know in high places within these businesses. Like, I'm talking about Nutrient and other places. And the first thing that they said is, "Man, I could really go for a bottle of scotch."
Yep.
And I was like, interesting. We judge people if they're homeless and they drink and they try to, like, numb the pain.
Now your
But the
shoes are
first
on.
thing that
Yeah.
we think about doing is numbing the pain, and we have no problem with going home and having some drinks because we had a tough day at the job.
After experiencing about 47 minutes of
Yeah, exactly.
Yeah.
Like
Yeah.
a
Right
glimpse.
off
It was
the
just
bat.
just
Yeah.
a glimpse.
Yeah.
And when you said survivor, I don't look at it as we survived anything, right?
Yeah.
We just saw a glimpse into someone's
Yeah.
life and was just like, holy shit.
Yeah.
Yeah.
Or like, that is like, and until you've seen that glimpse, or at least pay attention to understand why this exists, right? Like, what are some of the things of the reasons that people end up homeless, or what are the misconceptions on what people think?
Well, so some of the misconceptions are around, the conflation of crime and homelessness. A lot of people attribute, just like you said, like criminal and homelessness, and drug use and homelessness, and all these things. And that's the first biggest misconception. These folks are mothers, fathers, brothers, uncles, sisters. Like, they have family. They're like, these are folks that have connections to people. These are folks that have children or grandchildren. These are folks that they had a home somewhere along the way, right? Somewhere along the way. The misconception is that people are somehow choosing that life, and there's not anyone out that I've met in community that wouldn't choose to have a home. They just don't have that opportunity. There's a significant lack of housing that's been well documented, well talked about. We're all talking about it. But there's significant barriers to accessing that as well too. And then the other really interesting misconception is about, like I've lived a charmed life. Like there's several of us that have that life of privilege and haven't had to experience anything close to experiencing homelessness. One of the things that I always get people to think about is, have you ever in your life had to move back in with mom and dad, went to grandma and grandpa for a little bit of cash because you had a bill that you had to pay?
I've done them all.
Yeah.
Well, and
Numerous
so have
times.
I wouldn't
Numerous
I
times.
wouldn't still be in real estate if I didn't start out and live at my parents' house.
I wouldn't be
after,
here.
like-
I wouldn't be here without my parents.
And like all of that, like, now if you are someone that, for example, if you are someone that grew up in the foster system,
Right.
if your childhood was spent in care, this is that conversation about intergenerational trauma. If your childhood was spent in care, you don't have any of those fail safes. So when things get tough and you have nowhere to turn, and where the three of us would have turned back to mom and dad or that friend or whatever, like those connections that we know we can rely on if things really get
hard.
if they tank hard,
Yeah.
here's our backup plan. Navigate that without the backup plan.
I was thinking that. I was like, after doing the 2 challenges, I was like, how many people would let me sleep on their couch? and then how many people, I mean, some would be like, okay, Greg, I want you to leave. But then, but there would be then quite a few that would probably let me do it for a long period of time, right? And I was just like, man, I'm fortunate in my life. Like gratitude was probably the biggest thing that I took out of it, because I was just like, a lot of these times they just don't have these options, right?
Well, and now, like, you talk about community and you talk about family, in folks experiencing episodic or chronic homelessness, community and family becomes the people that you are sharing that experience with. So when someone is housed, when someone gets that dive house on the corner of whatever, right?
Yeah.
And you talk about sleeping on your friend's couch.
Right.
Well, now there's 27 people sleeping on the friend's couch.
Yeah.
And then all 27 get evicted because you can't do that, right? The house is getting trashed or whatever.
Yeah,
it
if you
might
look
be.
at it as a landlord's point of view, it's
It just, like, it's this reciprocal over and over again loop of, it's like nobody is choosing homelessness. It's really, really, really hard to get out of that loop.
Yeah. Well, that's I think the next question is, how do we help? What's the message we get out so we can help with what's obviously a huge, huge problem?
Yeah, and the problem with talking about homelessness is that it is so big that you just kind of spin. Greg and I talk about it often, and you just kind of spin in this, and you never actually get to an answer, right? Because everybody's constantly looking for that magic wand, like that one
Big fix.
The one big fix that's
yeah.
suddenly gonna, you're gonna snap your fingers and everything will be okay. And that's step one, is to realize that it's going to take us a while before we get to anything resembling okay.
Yeah.
There's a lot of work to do. There's so much work to do. But then I think we need to have a conversation about what are the little things that each of us in our roles, in our businesses, in our community, whatever it might be, what's the 1 or 2 little things that we could do? I heard you guys talking about 5 minutes of kindness, what a difference that would make. What a difference it would make if we walk by someone that's maybe sleeping on a bench downtown and we stopped and said, hey, how are you? And that was it. Like, what if that was it? What if it's just a connection, right? What if you're the person that makes someone feel seen that day?
And I understand where you're coming from, but a lot of times people are scared to do that.
Absolutely.
Right?
Yeah.
And so
Yeah.
the thing is, like, and I guess the reason that we're having these conversations is these are a lot of the things that people don't talk about, right?
Yeah.
And
Yeah,
it's just
exactly,
like, but you are right. Like, you're just acknowledging they're a person.
Yeah.
Like, sometimes people think I'm crazy because I'll say hi to anybody walking down the street. But at the same time, I have to admit that talking to a homeless person is different because you just don't know the reaction that you're going to have, right? And
That's fair.
and so why as people do we feel that way? Like, do you like?
Well, So I have some strong feelings on that
Yeah.
question. So I'll try to
That's
first
fair.
of all,
Like, am
yeah.
I a horrible person? To,
No,
like, it's
no.
just like,
See, no, that's not. That's the one conversation that we need to have. We need to make space for everybody to be where they are at on the journey of understanding what's going on here. Like
Right.
that's something that I preach every day. If you don't have a clue, that's okay. If you think you know everything but you're missing a couple pieces, that's okay. Like, it doesn't matter wherever you are on this journey. The thing that I always stress for folks is, like, go find out, go educate yourself, go learn something, but don't do it on the 6-second scroll on whatever social media app you're using, because those algorithms are our enemy. And we want to, like, I want people to learn from the folks doing the work what's going on in communities. So if you have a friend of a friend of a friend that works at one of the organizations that's working in homelessness, go ask that person, hey, like, tell me about what you do. This podcast, for example, this is a great example of how to create little ripples of education. Oh, I'm still stealing
There it
it.
is.
Yeah,
I
yeah,
smiled.
yeah.
I felt it.
The
That's
ripple
it.
effect.
Hell yeah.
Greg's been talking about the ripple effect and what you want to do with this podcast. Like that's those little things are how we kind of start some momentum. The other thing that I think is super important is that we need to give people a voice to talk about what changes they would like to see in our city, in our province, in our country. You know, this country is a member of the G7. That means we're one of the 7 most wealthiest nations in the world. The last time I checked is what that G7 means. We're in a province that's one of the most wealthy on a per capita basis in the country. And then in Saskatoon, we have extraordinary wealth. So if we're in the wealthiest city in one of the wealthiest provinces in one of the wealthiest countries in the world, and we have more homelessness than we've ever had before, there's something broken there.
Yeah, I agree.
So we need to have those conversations about, you know, giving people voice to ask for more and ask for more change, and then we need to have some real conversations about what are the infrastructure pieces, the needs. Your day job is in real estate, and you and I both know that real estate right now in Saskatoon, if any of us wanted to buy a house right now, it's really, really hard to buy a house right now.
Very hard, yeah.
There's
Our inventory is probably a quarter of what it should be.
Yeah.
Jeez.
And I don't think that's going to improve, and prices keep on increasing, and a lot of times people can't buy a house unless their family members help them with the deposit and so forth, right? And this isn't going to get better, I think. Like, if you look at many centers, this is where we're at.
So if you look at that, and then you realize that the guy with $1 million is having trouble buying a house, and then the guy with $500,000 is having trouble buying a house, and the guy with 250 is having trouble buying a house. Well, now let's get into the folks that are trying to rent a house. And what about the guys that are trying to rent a house with only maybe income assistance or SAD benefits? Or what about the guys that are trying to find a house just to sleep for the night? If all of that is going on, so it's just that trickle effect through the system. So we really need to have a conversation about how the impacts on this are really, really big, but the solutions need to start really, really small around, like, can we add one more door of accessible, affordable social housing, and what difference does that make? It houses one family, and then that family's housed, and then those kids are in a house, and then those kids grow up, and then those kids don't end up in care, and then those kids raise kids. And that's one door. So
Yeah, preventative care, looking at it right now for the investment, so that down the road we save. Actually, like, you look at it just on the economical side of things, right? Like, a lot of people look at it as money.
Yeah.
Well, we had this conversation, where's the healthcare system going to go? Like, what's happening right now, and what's, like, because there's so many vulnerables, like, taking up spaces in hospitals because they just don't have a place to stay. How does that then affect people in the future, right? That being our parents and so forth.
Exactly. Well, and that's that conversation about, you know, all of us are guilty of being immune to, you know, somebody else's condition. Homelessness, yes, I know it's there, but, you know, maybe it doesn't affect me, or I don't get it, or I don't understand it, but I see it, but I don't know anything about it. It doesn't impact me, but it does impact you. It impacts every single one of us. If anybody's, I don't know, have either of you had trouble going to see a doctor in a timely manner in the last few years? Yeah,
I'm quite lucky. I have a doctor, Dr. Nwani, shout out, awesome guy.
Nice shout out.
Yeah.
So like we hear stuff every day about how broken our healthcare system is. I think I passed 3 billboards on the way over here. That is an impact of homelessness. That is an impact. If folks are experiencing homelessness, they're experiencing barriers to sustaining their health. Health and homelessness are interrelated. Those things are irrevocably related. At Westside, Westside Clinic, among the many things we do, we're the largest HIV clinic in Saskatchewan.
So you work quite a bit with Sanctum then?
We work quite a bit with Sanctum. We do a lot of work with PLWA, all these different agencies, Saskatoon Tribal Council, around HIV work. We have hundreds of HIV patients. HIV is that's another conversation for another podcast.
We should probably save 5 hours for each one of these.
Yeah,
podcasts
exactly.
going
Yeah,
forward, because it's like, where do we
go?
Where do we go with this? Like,
with HIV, the example there is, it's super easy to live a healthy life with HIV with advances in medication. All you need to do is stabilize. All you need to do is stabilize and be able to take 1 pill a day. If you are homeless and you are having trouble finding a place to sleep that night, and if you are having trouble to figure out how the heck you're going to fill your belly that day, that 1 pill a day is the least important thing to you on that day.
Yeah.
So you don't stabilize. So you have more risk of being sick. So, and then that person that is at more risk of being sick ends up in the emergency room and ends up in the hospital, admitted to ICU, and then into palliative care. And then all of us that live in our privilege wonder why, how come we're having such a tough time accessing the emergency room or the ICU or palliative care? How come my grandfather, my father, whatever it might be, how come there's a waiting list for palliative care? Well, let's look at root cause stuff.
Right.
And that's some of that conversation around where these things intersect.
So how can people that are listening today support the Westside Clinic? Like, what is something that they could do today that would make an impact for your organization?
Well, so Westside Clinic and our partner agencies for that matter,
Right.
like the Tribal Council, Prairie Harm. So the 1500 block is those 3
Right.
buildings side by side. It's Saskatoon Tribal Council Health Center, Prairie Harm Reduction, and Westside Community Clinic. It's winter. The simplest thing is we always need warm weather gear. We have for some reason we have an inexplicable amount of toques right now. Somebody dropped off cases and cases of toques. But we're always looking for mitts. We're always looking for underwear. We're always, warm clothes. Socks are huge. Socks are huge.
And
So they're not
everybody
expensive
has,
either.
everybody
right?
has socks.
Go to, like, if you're stopping by Costco, they're the cheapest socks.
Yeah.
I think
yeah.
in the world.
People have unopened Christmas present socks still,
Yeah.
literally in the box
Yeah.
that just sit there.
And like, if you look at like folks that are experiencing homelessness are incredibly resourceful and also very, very good at taking care of themselves. They need some layers of insulation. They know they need to layer up in the winter, but socks are huge. Good footwear and socks are huge. So like little things like that. That's the simplest thing to do. There's lots of opportunities to volunteer time with many of the organizations in the city. And there's lots of opportunities to get involved with our advocacy as well too. The solutions around homelessness are about, the most prominent solution needed around homelessness is about physical infrastructure. Like we literally need more places. So not everybody can watch this podcast and say, hey, you know what? I have that extra $500,000. I'm going to go build a house.
Yeah.
I really do hope there's someone listening
would be awesome.
that would do that.
That would
would
be
really good.
awesome, yeah.
I have some design ideas if anybody is listening and has that, but not everybody's going to be there. So we need to make sure that we set the stage for that work to occur. So it's what can you do to get involved to set that stage.
Right. If you had all the money in the world, this is one question that we're going to
Which I don't.
We're going to ask, but the thing is, there is money out there.
Yep.
It's just, where is it being spent, right? There's billionaires and there's people with hundreds of billions of dollars, which sounds absolutely
Gross.
It sounds crazy.
Yeah.
Where would you start? And I mean, take in mind, like, this is not a 12-hour answer.
I'm really
But-
good at 12-hour answers, though, Greg.
That's the go-to.
So I think the answer to that is a 75-25 answer. So you take for every dollar, right now about 99.9% of our dollars from whatever level of government and private venture are invested to fix the things after the problem. We are all of our money is going to solutions to problems that we can see. We have a crime problem, invest in
So
police.
we're being reactive.
We're being
our money's
reactive.
being
Yeah.
spent on
Yeah.
being reactive.
And my thought, if I had all the money in the world,
Yeah.
for every dollar that I spent there, I would spend 3 at the other end of the spectrum. And the other end of the spectrum, I think we need to invest heavily in the most challenged, most vulnerable, most susceptible part of things. If we could stabilize the lives and the health and the housing of the 500 most vulnerable people in the city of Saskatoon, we would see system change throughout every sector that would be felt by every single person living in this city. Wow. It's that simple.
See,
Right.
and just sitting here and learning and listening, I draw so many comparisons to just like people in society as a whole. I say it all the time about how there used to be a time where we cared about others before we cared about ourselves.
Exactly.
And now we're in a world where everyone cares about themselves and no one cares about anything else.
Yeah.
So when you talk about, saying hello to the guy you see sleeping on the bench, a lot of people won't even think about it because all they care about is how they are going to do them, what they're going to do for themselves. And all I'm hearing is, how do we get back to caring about others? That's
Yeah.
one of the biggest hurdles, I imagine, right?
Well, and I grew up in this province. I've lived my life here. My parents homesteaded here on, my parents homesteaded on land that was part of Flying Dust First Nation up by Meadow Lake. And my privilege is born completely of that. And it's from that time when, like, my grandfather did say hello to everybody that he saw, and nobody thought he was crazy for doing it. Because that's that way, right?
That's how it was.
That's what it was.
What I'm saying.
And to your point, we need to get back to that where we give a crap about everybody.
That's
Like
it.
we're
It's so
the
simple to
human
me.
in us,
Yeah.
right? Like we've lost that.
it.
Yeah, we've lost that humanism.
100%.
Yeah.
I've been saying that all the time here, to the point where I feel like I'm the crazy one, because it's like, how can it be so obvious to me, but everyone else just keeps doing what they're doing? Then it motivates me to be the guy like Greg who says hi to people, say hi to strangers, try to make someone's day.
Yeah.
It's the littlest things, but
Goes
they go so
back to
far.
that 5 minutes of kindness.
That's it. Ripple
really
effect.
does.
Get
Ripple
that
effect,
ripple
yeah.
going.
It really does. Like, give you a perfect example of this. You guys can edit it for time. I know you're going to chop the crap out of this.
Probably not. So
Probably
you should
not.
probably
This is really
not keep
good.
on saying
Yeah.
that.
Yeah, okay. This morning on my way to work, so I got to work about 7:30 this morning, or about 8 o'clock, I guess it was, and I was crossing the street, and there was a young lady walking with her. She had a little pit bull on a crudely made leash, and I know this person. She's a patient of the clinic. She experiences some really significant challenges in life, but I stopped and I teased her about, it's like, boy, on a day like this with your dog, that all you need is a pair of skates and you'll get to where you're going. And we interacted, and I love dogs and I love pit bulls, so I gave her dog a pet. Her dog was super friendly, and we chatted for maybe 10 seconds. But today, I was able to start her day with someone that she doesn't really know, meeting her on the street and making her feel like she was seen, she was there, she was. I was happy to see her. I was happy to see her dog, and she responded to me with a smile. And when we parted ways at the other side of the crosswalk, she said, "Have a good day."
Who do you think got more out of that?
I did.
Yeah.
Totally. It's
Yeah.
all about me and that
Yeah.
interaction, right? Like
You're so selfish.
I left feeling that
No,
just
but it's
absolutely
true. It's
wonderful.
Like,
Yeah.
You
100%.
do good things for people, and it
Yep.
makes you feel good.
It
So it's sometimes
does.
a selfish act, but it does feel good to feel good.
That's the best selfish act to make, if you ask me. If you're
Right.
feeling selfish about helping and acknowledging others, like that's a pretty good selfish for me.
Yeah.
That's a start.
Well, Toby, it was awesome to having you on here. Thank you for the
Thank you.
insight. And we're going to continue to interview people like yourself, which is making a huge impact in our community. And if you have any ideas of other people that we can have
I've got a
on,
list. I've got a list.
Absolutely.
Yeah,
Bring
and
them
then, yeah, we do appreciate it.
And
So
the
thank
list
you
is
so
long.
much.
Like that's if you know, that's something for folks to hear, is that there is I say it all the time, there is a not so small army of people doing incredible work in this community. Get to know them and find that person that you can connect with.
For sure. If anybody's looking to find these amazing organizations, we have 66 charities on onesmallstep.com. Go there. You can use the search bar to be able to enter in who you're looking for or what you're wanting to donate, and it'll pull up their profile. You'll be able to find more about their programs and also about different information that you might not have known, right? And so it gives you a lot of that information, and it's kind of like the Google for charities or nonprofits, right? So, and hopefully we continue to keep on growing that this year. So thank you so much for coming on and for the time. And I owe you some donations for these kick-ass shirts.
This awareness and this podcast, this is the work that earns you a straight
there
out
we
of
go.
1,500.
Hell yeah.
That's awesome.
I love it.
There
I
you go.
appreciate it greatly. This has been fantastic. Like I used to hate learning in school. I was like, learning, school, blah, blah, blah. But as I grow older, I've come to really appreciate the moments where I'm legit doing nothing but learning about something I know nothing about. And that was one of these moments. So thank you for giving me that. There's me being selfish again. Thank you for that.
You bet.
And I look very forward to doing more good things, my friend.
Awesome.
Thank you.